causing ill health to people outside of the hospital. So they look at things so far like pushing green building. If you're going to build a new hospital, make it green. Decrease the amount of energy. Hospitals use they're the second highest user of energy per square foot compared to hotels are number one. So they're using a lot of energy. They're open 24 hours a day, 7 days a week, and they're just lots of people in and out. Food is a huge issue. Hospital food, everybody knows the connotation of hospital food. It's not very good, and it's definitely not local, sustainable, organic, none of those things in a lot of places. Though here at Fletcher Allen, there's actually a really good food system going on here.
Healthy food at a hospital, that's a bad business model.
I know. Well, yeah, absolutely, absolutely. And that's kind of one of the questions of the whole system itself. In a way, we're really making people outside of the walls of the hospital sick in a lot of ways. And, wow, we're kind of doing that, and we're creating business for ourselves in the hospital. It's kind of an ethical question for sure. So these places of practice, green health, healthcare without harm, have kind of been looking at certain aspects of the impacts that hospitals and medicine has on this larger picture, but they haven't really looked at the practice of medicine, and that's what I have been doing, actually going in and shadowing physicians and nurses and pharmacists and administrators and trying to understand what is it that's driving this system at the patient level for decision making, and what are the specific impacts that that practice of medicine has on the environment and on human health. And of course, when you look at these environmental aspects, you'll see that there's going to be a direct link to the cost, because we're generating a lot of waste, and it's just skyrocketing the costs of things. And we'll talk about that more as we get into the data that I have collected.